So we are seeing part 2, last part of our topic, bronchitis. And we are going to answer 2 questions: the complications of bronchitis, treatment and prevention. Okay. What are consequences? What are the complications of bronchitis? There are many. There are many, including infections like pneumonia, pneumothorax, where the air gets into the pleural space outside the outside the functional units of the lung. Difficulty in breathing, very severe respiration, dyspnea, and there is also what we call severe respiratory failure. The lung can fail completely to function, and there will be enlargement of the heart, because the heart will be affected as well. The heart failure caused by lung diseases. COPD, chronic obstructive pulmonary disease, emphysema, polycythemia, and high mortality rate is observed in very severe cases of bronchitis. We are going to see what these terminologies mean. It's a bit complicated, but we are going to know them as we progress in the following slides. You can see if we start on pneumonia, it's infection in the lungs, where the functional unit alveoli, they will be having pus inside. You can see infection will come inside. Remember, bronchitis, inflammation is here in the bronchi, but the mucus that is not able to be expelled out, they will get stagnant here, and the bacteria will multiply inside and will cause this kind of infection. And on X-ray you can see that the part that is affected is different from the normal part. Okay, so now when you check what we're told, pneumothorax, it's a accumulation of air outside the lungs but in the pleural space. Normally the lung is covered by a membrane called pleura, and between the pleura and the lung there is a space normally where the lung would be expanding, and as the breathing is going on. In normal checks they should look like this. All right, look like this, good air entry bilaterally. But now when you see here, now the lungs have collapsed. You can see there is a gap. This is a lung, this is a structure of the lung. So anything that can cause a perforation of the lung will cause the air to get inside, then will be called pneumothorax. This is a bilateral one, and it's very severe. It's a deadly condition if there is no emergency taking place. Here, to see it clearly, much better, you can see the membrane. This one, the black around here, is a what? The pleura. And now this pinkish or gray, it's a space where the lung will be expanding as the breathing is going on. Now once there is a perforation, the air can pass through the lung and come here in this space. Or if the perforation is from outside, then it will cause what we call pneumothorax. Then the lung will collapse. That's very bad because the breathing will be compromised. Then we can see the complication of bronchoconstriction, where the bronchi will close. Then the breathing will be a problem. The mucus is too much, and intervention is needed as soon as possible. A normal heart, which is having this size, now if it is compromised due to bronchitis, it will be enlarged. Why is it enlarged? There is a pressure in the lungs pushing the blood back, and the heart is pushing the blood again, sending to the lungs. Then eventually this muscle will get dilated, will be enlarged heart. That was not expected. It's a very bad complication. You can see it here clearly, that the muscle that has been previously well functioning well, very thick, but here become very thin and it is very dilated, so the blood will be filled here and does not go to the lung easily. So many complications will follow. Respiratory failure, that will need the patient to be intubated. If there is no intervention done, then it can cause a complete failure. There is what we call emphysema. Emphysema is when you take those alveoli that we saw, they get damaged, and you remember they were small sacs, but when they are damaged in many numbers, they form a bigger sac. You can see these are the bleb. You can see now a big sac here where the lungs is no longer functioning. So it's a useless space because there is air without sending oxygen to the other systems of the body. It's a very bad complication, emphysema. Then when you take blood, because the body has been trying to compensate, trying to cover the gaps, as the body works hard, it will fabricate more blood. And when you take blood, you'll see what we call polycythemia. You will see a lot of blood, a lot of red blood cells, because it's a mechanism where the body is trying to defend itself in forming blood so that it can be able to generate the mechanism of capturing oxygen, taking it to other tissues of the body. You see the complication where it can reach a patient to intensive care unit, and if nothing is done on time. Bronchitis is a condition that's affecting many countries, but mainly less developed countries. You can see the data is showing that Africa and Asia, Asian countries are more affected. Yes, other countries are affected as well, but when you see statistics, you can see what the indoor air pollution deaths, it was higher in Africa, in this Asian part of the world. So we need to wake up. And how do we treat this condition? How is the treatment and prevention done? Now, there is preventive measures and there is medication. For the medication part, it is done either for short term or long term. For short term, even for long term, there is an objective to improve the activity of the patient. We need to reduce the flare up, and we need to decrease the obstruction, because the main problem is obstruction. You cannot breathe in and out, and there is a decrease in, to decrease the shortness of breath as you are giving treatment. So these medication, they are into groups. It is either bronchodilators, where you want to dilate the bronchi so that you can breathe well, and corticosteroids, medication that will help to fight inflammation. The section that was swollen, you want to fight that swelling. Antibiotics, if there is an infection, you want to fight that infection and destroy those bacteria. You can see they suggest that the treatment should be going into steps, because bronchitis can be mild or it can be severe. If it is mild, self-managed, and if you stop smoking or you stop the factors, then you can improve. Or if it is mild, you can just put the short-acting bronchodilators. You can see here, as the function of the lung capacity is going down, the more it goes down, the more dyspnea goes up, the more difficult in breathing goes up. And when it is too high, it is very bad. To the late stage now, end stage of respiratory failure, it can even need surgery. You can see. Now there are other methods that are used to improve the treatment. They are very important, very supportive, where physiotherapists can help on the postural drainage by putting a patient in the different positions where the fluid can be drained, and they have to do some maneuvers. Then they do some maneuvers when helping the lung to excrete all the fluid going outside. Exercises do help a lot in improving on the breathing. Education, lifestyle changes. We spoke about the negative impact of the smoking, and stopping smoking is very important. If you have bronchitis, one of the first steps that need to be in place is stop smoking. Then, second-hand smoker. You don't smoke, but you are with a smoker. you are breathing still the smoke from the person who is smoking. So still, prevention is regarding the whole management. You are concerned as well. Then vaccination. You have heard about influenza, pneumococcal vaccine. These conditions need to be vaccinated, because if there is infection from these bacteria, it will be much worse with bronchitis. Okay, so avoiding irritants, the factors that we saw, if you avoid them, it will help a lot, whether in the workplaces, whether during the recreational places. We need to minimize the risk factors. Hygiene is very important. Hygiene, because the bacteria would make the infection worse. So when you have your hygiene, you will make sure that cleaning with a soap is a constant habit. The study was done, it was shown that people who go to toilet, or for any other reason actually, washing hands, some people wash, others don't wash. You can see 80% of infections are transmitted by hands. That is a fact. And the study was done with students who were washing hands after using the bathroom. They were only 53. And while those who just take water without a soap, 18%. You can understand that there is a risk. So we are advised to wash hands over and over, for it should be a good habit for everyone. All right, thank you so much. We are going to see part 2, where we'll be able to address all the factors around, including final treatment. Thank you so much.